النهارده is our last attachment conversation of the semester. متحمسه جدا جدا على الكونفرسيشن دي انا وليلى بقى حابه بنتكلم عليها and يعني really looking forward to the topic and to having Laila as the speaker. قبل ما ابتدي وقبل ما introduce Dr. Laila, I want to thank the team, my research team, who have been amazing in terms of their help and support في events. Particularly Maya and Jana, عشان هما they were directly involved in الإيفنتس اللي فاتت كلها. ف every week إن إحنا نبقى بنتقابل وبنعمل ده, this actually takes a lot of work behind the scenes. ف يعني I want to thank them very much for their effort. و thank you to everyone who has been attending, سواء talk أو كلهم أو كل ما تقدروا أو حاجة, عشان مبسوطة قوي نبقى عندنا حاجة regular كده بنتقابل فيها. Hopefully we resume في spring semester وتيجوا تاني ويعني with more and more interesting topics إن شاء الله. So for today's talk we have Dr. Laila Abdel, who is a Harvard and Columbia trained licensed clinical psychologist. She's a former Columbia University faculty member and she currently teaches as an adjunct professor هنا في AUC. She works with adults navigating trauma, mood concerns, personality structures, life transitions, cultural and immigration challenges, حاجات كتيرة قوي, both in Egypt or in the Arab world and the US. She has huge amount of experience, honestly, and I'm so looking forward to hearing her insights on our topic today about disorganized attachment تحديدا and complex trauma. So welcome, Dr. Laila.
Thank you, Dr. Noor. It's so nice to be here. يعني there's some familiar faces. It's so lovely to see you.
كل حد that you've talked, عايزة أقول لك إنه يعني the feedback is always wonderful الحقيقة, فبجد I'm looking forward to this جدا. الtalks بتاعتنا اللي كلها لما بنتكلم على attachment we end up talking about avoidant attachment and anxious attachment and secure. We rarely touch upon disorganized attachment في الtalks اللي فاتت كلها, يمكن عشان it's a little bit more complicated وعنده nuances بتاعته, فبنيجي كده لغاية الحتة دي وبعدين we kind of skip over it شوية عشان بتبقى محتاجة تركيز لوحدها. I'm so happy that today we have a whole talk about that. فقبل ما نبتدي if we can define what attachment is من وجهة نظرك and what trauma is قبل ما ندخل في disorganized attachment, لأنه trauma النهارده is very important.
فبالنسبة لي attachment is a relational template. Okay, it's the early relational template that the child develops. Within this early relational template, the child needs to know that there's continuity and there's safety and there's space for the child to be their authentic self. فمثلا Winnicott, he's a psychoanalyst, he's a child psychoanalyst. He often talks about how parents need to create a holding environment for their children. When this attachment occurs, then the child is set up for success because they know that other people will hold their mind in their minds. What does that mean? And they'll be able to mentalize them, which is الشخص الادلت او الparent هيعرف ان هو يستوعبه ويعرف هو بيفكر في ايه. Okay, but there's this understanding of they will take the time to understand what I'm thinking, and so in doing so, if the parent does that for the child, they model it, and the child learns how to do that for others. Okay. Another part is that the child needs to know that their emotions are acceptable. كتير قوي من الوقت parents, especially if they've experienced their own relational trauma, they don't have a lot of capacity to hold their kids' emotions. Okay, so one thing a child needs to learn is that my emotions will be held. It doesn't mean that everything is condoned, but it means that it's mentalized, it's understood, where it can be contained. فإحنا parents, like the role is to be a container, our holding environment. And then the last thing is the child needs to know that they can be authentic. كتير قوي بالذات في العالم العربي parents have certain expectations for the children, right? Like and especially let's think gender roles too, right? الولد بيعمل كده, البنت بتعمل كده, or like in our family إحنا دكاترة. If the child turns out to want to be an artist, مثلا I was very interested in art, it's poo-pooed. The whole idea about the holding environment is to create some space, allow for some space for the child to explore themselves, to get to know themselves. عشان attachment is about getting to know your core self in relation to others. So it's not just yourself, it's being able to understand that you're part of a holding environment. Okay, when your actions have consequences on others and vice versa. Trauma, in contrast, is what happens when this doesn't occur within the family. Okay, when there isn't a holding environment for the child learns very early on that they need to hide parts of themselves. Okay, they need to hide certain feelings. But what happens is they split these parts off. They're very young. Like their frontal cortex hasn't developed. But the ability to think. So what they learn is just put it away. Okay. This is what a lot of psychoanalysts say, they dissociate. They dissociate أو self-states create. فأنا مع الشخص ده أنا هوري البرسوناليتي. وأنا مع الشخص ده هوري البرسوناليتي. I can't come as my true self. A lot of what happens in trauma, the way analytic thought thinks about it is الواحد disintegrate. بيحط part هنا، part هنا، بيخبي part هنا. A lot of the trauma work, what we try to do is to create an environment in therapy where people can bring in all of their parts, where we can understand their parts, and where then people can make a conscious decision, eventually, inshallah, whether a part should be acting out or not. My goal in therapy is to help people eventually be able to make a choice. Do I want to act in this way, or can I act in another way?
Okay, حلو قوي. This is very good as a foundation كده ان احنا نبتدي نتكلم فيها. وانت بتقولي كده كمان it reminds me انه attachment theory لما بدأت تبقى موجودة هو قبلها كان the psychoanalytic theory was very prevalent, right? وpsychoanalysis بيقول انه او psychoanalytic theory بتقول انه the self emerges first and then relationships happen later. Attachment theory بتقول العكس، ودي من اكتر الحاجات اللي بحبها فيها قوي. بتقول انه relationships happen first from which the self emerges. So it's your relationship with the caregiver that emerges at the beginning. دي أول حاجة أنا بعرفها قبل ما أعرف أنا مين. أنا ببص على نفسي في المراية أنا مش بعرف إن ده أنا أصلاً. أنا أعرف الأول relationship and then from the relationship myself emerges. فأنتي اللي بتقوليه إنه I see myself in the eye of my caregiver and in that experience قبل ما أنا أفهم نفسي أصلاً في الأول.
That's 100%. But I wonder if, in a way, they're kind of connected, right? Because I first see my relationships and then I'm able to develop myself. But what if the relationships create this space to develop yourself? I want to know. This is what you're saying. Yeah, exactly.
Yes.
Yeah.
So احنا كده اتكلمنا على attachment in general what it is in trauma. دلوقتي زي ما كنت بقول احنا كتير قوي بنتكلم على avoidant attachment and anxious attachment لما بنقول insecure attachment. بس عايزه ان احنا نوضح اكتر what is disorganized attachment. التايب اللي هو مش بنتكلم عليه كتير او it looks like it's a bit more complicated هو ده ايه بيجي منين and how is it different from the other types of attachment.
So the way I understand it is that في الآخر في الآخر avoidant attachment و anxious attachment are strategies. ماشي هو it's a coherent, it's a strategy that makes sense. Anxiously attached children often can amplify their distress as a way to keep their caregivers close. Avoidant attachment kids suppress their distress عشان they don't want to be rejected by their parents. فهو في الآخر في strategy. Disorganized attachment بقى المشكلة إنه مفيش strategy. علشان the parents في disorganized attachment the child doesn't know what they're gonna get at all. Okay? يعني هو ممكن one time they get a parent that's super loving and then another time they can get a parent that hits them or that's very aggressive. So it becomes like this paradox for the kids and how the person that's supposed to provide them with safety actually scares them. فبيحصل كده system error اللي هو أنا رايحة لك you should give me safety but you're giving me fear to when should I come but I need you. I really need you. I'm a child. I'm longing for your care but I'm also afraid of you. So as a result of that that's when we start seeing, and personally in adult work, right, I haven't really seen that primitive, raw form of disorganized attachment, because eventually, as people grow up, they develop packs, I call it like personality structures, that they build on that foundation. The way I see it is, okay, disorganized attachment is a cracked foundation. As you grow older, you need to create some way of coping. It's not a clear strategy, but it's a way of coping. You have to build a house. The house is a bit shaky, and it really depends على الفاونديشن عامله ازاي, how cracked it is, الhouse هيبقى شكله ازاي. If I can imagine for kids, it's like very like behaviors اللي هو I come, I don't come, like very strong emotions, like if you give them care, they run away, if you don't give them care, they're throwing tantrums. In adulthood, the way I think I see it is in complex PTSD or oftentimes borderline personality disorder. And what I really want to highlight in this talk though is I think borderline personality disorder gets a terrible reputation. Okay? أول ما بنسمع BPD we're like, oh my god, terrible person. My aim from this talk is to try to create some empathy for why people develop that personality, I don't even want to say disorder, personality structure or organization, right? It's a way to protect from the deep, deep fear of abandonment and not feeling cared for. For what I often tell my students, and then also what I try to hold in mind when I'm working with my patients and try to like, right, it depends كمان how to crack the foundation is, how direct you can be initially. But it's not your fault that this happened, but eventually it will become your responsibility to figure it out, right? Because if you haven't figured it out and you have kids of your own, it's going to be really difficult. If you haven't figured it out and you're in a relationship, it might be very hard for you to continue being in a relationship. ففي الآخر بيبقى فيه لازم نعمل grieving للي حصل عشان نعرف نتقدم.
Yeah, absolutely. بفكر كمان انه عشان في اللاب هنا when we see observations between parents and kids, زي ما انت بتقولي there's a coherent strategy that comes with avoidant and anxious attachment. You can see what the child is doing and why they're doing that. ففي هدف في الآخر عايزة أوصل له وأيا كان it's working منين ومين لا, بس there is a specific coherent strategy. Where disorganized attachment بيبقى فيه breakdown of this coherent strategy in the first place. حتى in children we see it في حاجات ممكن تبقى مش مفهومة قوي زي الاستراتيجي الثانية, زي مثلا a child who's freezing, like a dissociation response, like حاجات فيها أكتر إنه you really don't understand the direct goal of the behavior, يعني so to say. طيب هل احنا ممكن نقول إنه disorganized attachment is a kind of a trauma imprint? Is that what we're saying here?
Yeah, that's definitely what I'm saying. طبعا maybe there will be different opinions elsewhere, but the way I see it is كده. I really think that if we look at it in that way, we will have more empathy and understanding for our patients. And كمان you can work with patients to like try to have a more fulfilling life. Now, because right, like what I want my patients to understand is like, you're not bad, right? Like you're not inherently bad. It's just the way that life has shaped you in that way, in a certain way, and you're reacting in certain ways. But we need to change these ways. And I think something that also has been very helpful for me in my work is I think a lot of times when we hear trauma, بنفكر على طول في like big T trauma, like sexual abuse, a lot of like physical violence. Well, I think, so during my internship, it's like pre-doctoral internship, لازم تروح تشتغل في مستشفى وانت في أمريكا like for a year. And I had the privilege of working in the Victims of Violence Clinic, which is like Judith Herman's clinic. وهي she's like a big trauma person.
And big trauma person. Big trauma.
فهي they had done an informal survey amongst their patients and they found out that هو مش sexual abuse وكده اللي هو أوحش حاجة اللي هتحصل. هو أوحش حاجة اللي بتحصل إن يحصل الإيفنت ده and then your caregivers don't hold space for you to metabolize the event. Whatever happens, طبعا obviously it will traumatize, but at the end of the day, if you have that safety net, you need to metabolize it. وبشوفها with my patients يعني so many patients experience like sexual abuse and because the parents couldn't hold that environment, they developed defenses. فالجزء كبير قوي من الشغل هو أولاً I know Dr. Henny says that a lot because I heard that from students and I say that too, so I'm referencing Dr. Henny. Respect their defenses. يعني أنا مش عاوزة إن أنا أخش وهد. أنا بخش وبفهم وبالراحة هننزل مع بعض ولازم أدي للشخص تشويس عشان في الآخر trauma is about you're completely out of يعني أنت ما عندكش control. فأنا مش عاوزة إن هم يخشوا therapy معايا ويحسوا إن هم out of control تاني can be re-traumatizing. So it's about giving them agency.
صح. والديفنسز دي كانت موجودة for a reason. So the fact that you respect them that is also حاجة مهمة قوي in the process. هندخل أكتر في therapy process because I know many people will be very interested to get to this part. بس عايزة الأول نشرح لما أنت بتقولي إنه in disorganized attachment أنا عايزة أروح للcaregiver بتاعي for safety. This is what my attachment system is telling me to do. بس في نفس الوقت my defensive system is telling me لا get away from that person because this is also the source of fear. My source of safety and my source of fear. Physiologically, what's happening to that person, to that child, and to that person as an adult?
I think what we need to remember, and what Anna, I sometimes like fail to remember. I think having kids of my own is reminding me of this. It's like kids, ما عندهمش logic. Okay, فهو it's a physiological reaction. هو في الآخر it's their nervous system is activated. It's not their psychology. Eventually it becomes a psychic reaction because they have enough time. They can make meaning of what they're feeling inside. But the meaning is that they make can be كمان. I was gonna say flawed, but I don't mean يعني إن هم غلطانين. I just mean that it's based on a physiological reaction that might be immature or self-blaming, right? Because a lot of the time what we see in kids is it's easier for a kid who experienced trauma to blame themselves than to blame their caregivers. If I blame myself and I say, لا والله, maybe I was asking for it, I wasn't a good child, I was مثلا too disruptive. This gives the child the feeling, okay, if I work a bit harder, my parents are gonna be better parents. Instead of accepting, maybe my parents have their own things that they haven't dealt with, and as a result, they didn't show up for me in the way I needed.
هنا sorry إن أنا بقطع بس هنا في كنترول أقل يعني على الأقل لو هي غلطتي أنا لو أنا اللي وحشة it gives me at least this distorted perception إنه على الأقل عندي شوية كنترول إن أنا لو بقيت أحسن لو أثبتت حاجة لو كده I can fix it maybe.
100% it gives the child hope. أنت متخيلة like a 3 or 4-year-old يبقى عارف إن بقية حياته لغاية ما هو عنده 17 سنة هيعيش مع أهل هو مش عارف how they're gonna respond to him and he'll never feel loved or taken care of or protected. It's such a scary feeling and getting goosebumps even talking about it. So let me blame myself. And so فكتير قوي جوديث هيرمان كانت بتقول عشان هي أنا شايفة لو سمعتوا عن complex PTSD diagnosis فهو
أحسن النقطة مش كل الناس سمعت if you want to give a brief description.
Sure. For complex PTSD, basically what Judith Herman is trying to do, or has been trying to do, is to make it an official diagnosis in the DSM. It's currently in the ISD. Well, if you look at the diagnosis itself, it's basically borderline personality disorder. Okay? The reason why هي بتحارب قوي إن هي تعمل complex PTSD instead of BPD is because it moves away from this the shame of BPD. يعني طبعا في مدارس تانية also very analytic school or DBT كمان we're saying لا let's keep BPD and let's change how people understand it. But for people like Judith, it's like Herman, it's like لا أنا if I tell a client you have BPD, it's gonna be really hard for them to metabolize. Because if I tell them you have complex PTSD, then maybe we can work through it. There's more space.
انت بتقولي على complex PTSD حاجة ليها علاقة بالفيزيولوجيك كنا في حتة الفيزيولوجيك response control all the way
ايوه اوكي
control
ايوه فكانوا الريسيرش مش مهم. انت حد عنده سؤال قبل ما يعني مستنيين ان انا اروح حته معينه ولا
لا؟ I have a question about you saying
yeah.
the difference between complex PTSD and BPD.
Yeah.
Does that change personality disorder element in any way?
As a what, sorry?
Does that change the personality disorder element of it in any way, by changing it from BPD to complex PTSD?
I think it just makes it more palatable. يعني هو في الآخر the way أنا still like I'm very influenced by psychodynamic psychoanalytic thought. فأنا لو أنا ببص على حد like I always ask my class to read Nancy McWilliams, okay? And the way she talks about borderline personality disorder or borderline personality structure is in Hoa, it's like a continuum, and because of those physiological states and because of not being contained, people with that structure go from being able to be in reality to not being able to be in reality. Okay, عشان it's so confusing that sometimes they get super paranoid, or sometimes I feel like this flavor of everyone's out to get me, no one loves me, right? And so I think that's also part of the physiological states. Feelings become so overwhelmed, feelings are not metabolized, you can't connect to your feelings because you don't understand them, no one's modeling for you how to understand them. All you know is that I need to put it away علشان I don't know what's gonna happen to me.
Yeah. عايزة أدخل أكتر في حتة الثيرابي. If you have someone who has these types of defenses اللي هي مش دايما make sense قوي من برا زي ما قلنا في breakdown of this coherent strategy, but to them they're trying to find safety in any way they can. في therapy room where it's a place that you supposedly get vulnerable, talk about a lot of insecurities وحاجات زي كده, how does that show up in the therapy room?
I think for me, I pay attention to my counter-transference, which is like my reactions to the patient, and I realize that I feel very confused. Okay? فلو أنا ابتديت أحس جوايا شو اللي بيحصل؟ وقتها ببتدي أحس okay, there's like disorganized attachment happening, there's like a complex PTSD, like, right? Because again, it's like a cracked foundation they build upon it to house, but it depends on how primitive it is. Is it more childlike or is it more adult-like? I notice confusion. I also notice, for me, like, sometimes I want to go in and rescue, right? So this pull to rescue, or this complete pull of, this push. I do not want to see you anymore. Like, I cannot tolerate this. This is like really overwhelming. And like, also something that because look, I think it's important as therapists to know who we are, okay? I know that I'm a shame-prone person. What does that mean? I can feel shame, okay? But if I start feeling shame in the therapy room, then I'm like, oh, okay, if I feel like either I'm not enough, either I'm too much, either there, then I also know that, okay, this other person is probably feeling that too, and because I'm shame-prone, it's getting triggered for me, and this is another sign for me that there is a trauma component, there is disorganized. I think when you're working with these clients, what you need to tell yourself, and that's something very hard for me, it's getting much easier now, is that the work is going to take time. Well, this is especially hard هنا في مصر. الناس بتجيلك في مصر like يلا 12 سيشن وعاوزة اطلع. اوكي؟ أنا بقالي بشوف ناس 5 سنين. If there is really deep-rooted trauma that has affected the defenses and has changed how the person relates to themselves and others, it takes a lot of time. And so, be patient, be attuned to the client's shifts. Sometimes interpretation can be very overwhelming. يعني أنا بحس برضو, especially if you're a new clinician, the pull to impress the client is there, right? You want to be like, على فكرة أنا اتعلمت دي بقى, ده اللي بيحصل دلوقتي, okay? This can feel too much. But either noticing how their emotional state, just naming it, like, you're seeming really overwhelmed now. What happened? Okay? You name the emotion, you name what you're seeing, what the caregiver should have done for them but wasn't able to, or you provide psychoeducation. This is that I learned at the Victims of Violence Clinic, which is psychoeducation can be very validating and moralizing. لو أنا عرفت إن أنا مش الوحيد اللي بعمل الحاجات دي, I won't feel as bad about myself.
طيب, we assume in therapy إنه لما الكلاينت بيحس بالsafe environment and this whole environment that you were describing, فإنها هتبقى corrective emotional experience, or they get to experience themselves بطريقة ثانية. بس with disorganized attachment ساعات اللي بيحصل إنه safety feels threatened. فأصلاً إن أنت you accept me وإنه I feel safe هنا, فبيبتدوا هم نفسهم يحسوا لا this is not familiar, I don't know what that is, and this is threatening. How do you work with that in therapy?
It's really hard. It's really, really hard because I think part of what you need to do is you need to accept that sometimes it's not the right time for patients. You can be holding on to so much hope for them. They're not in the place to receive it. And it's so heartbreaking, right? Like you want to be able to say like, come on, we can work through this, like come on, like but it just tells you about the extent to which they've experienced emotional turmoil. I think the best you can do is I talk a lot about frame to my students, hold a therapy frame, like hold a therapeutic frame, which means be consistent. Our sessions are every Monday from 9 to 9:45, or 9:50. Our fee is kaza. I will be here no matter what. If I need to reschedule, I'll reschedule, but I'll reschedule in advance. Like, for the person to start realizing that you're solid. People might freak out and like to accept that it's not in their control, if anything, to know that one of my supervisors once pointed out to me that maybe this is their way of feeling in control, right? Like, so maybe that in itself, you can reframe it too. For once they felt they had agency to leave you. They've never been able to leave. And I think it's a kind way to like put it, but to like give yourself grace and give the patient grace.
Yeah, that's interesting. وبتشوفي إنه لازم clients have to work through the trauma that happened in their past, ولا new relational experiences ممكن تبقى كفاية in that sense, ولا we have to really go back to the trauma and work through it.
بصوا أنا ما بحبش عامة إنه يبقى فيه rigidity. اللي هو ما أنا مش مقتنعة إن there is one way and to healing. I think it really, really depends. I think for some people relationships اللي احنا عارفينه عن BPD مثلا is if you are in a long-term relationship and you have a long-standing career, intensity بتقل. Okay? That in itself shows إن في healing part. بحس إن أنا ساعات كتير بسمع من patients, I first need to heal before entering a relationship. And to me that's really unfair because like, maybe you can be in a relationship and heal and do therapy at the same time. Maybe for some people, but at the same time I can be hold in mind that for some people maybe they will not be able to be in a relationship until they're in therapy just because they're so erratic and their partner ما فيش capacity ده أو هما ما فيش capacity to being in a relationship because they're so afraid. So it really depends. I would say like ACT, like acceptance commitment therapy will say, and these are like more behavioral therapies will say, we don't need to revisit, like DBTs also act as like we just need to accept that there's psychological hardship and move forward and like be in relationships and things will improve. DBT will be like, I'm just gonna teach them skills, and if I teach them skills, they're gonna get validated for acting differently, and so their relationships will be possible. Analytic and dynamic thought are like, maybe we need to unpack this while they're also in a relationship.
طب انتي من شوية كنتي بتقولي انه children have their own meaning making كده mechanism where probably هيبقى انا الغلطان انا this had to do with me. لما الواحد بيكبر ممكن ده يفضل نفس الحاجة ممكن يتغير، بس اوقات كمان بيكون في cultural narratives بتnormalize حاجات معينة، زي مثلا في الكالتشر بتاعتنا ممكن شوية it's common انه حاجة زي physical discipline مثلا، انه كلنا اتربينا كده، كلنا طلعنا زي الفل، this was for my own good whatever، يعني any kind of interpretation let's say that the client has. Do you challenge this ولا do you, يعني how do you work with that?
I do, but it depends on the client and how fast I challenge it. يعني بالنسبة لي I try to assess how tied are they to this narrative, and before, يعني in general, before challenging anything, I want to understand why are they tied to this narrative? What is this narrative giving them? علشان, for instance, about the like someone hitting them, right? It can be their way to stay connected and loyal to their family and to their culture. لو أنا ابتديت أحس إن لا they were bad to me, I'm gonna cut off, right? Or I don't want to be connected. And so it's their way to stay connected, and they disavow, which is like they put aside, certain other feelings of like, la, I felt afraid, la, I felt harmed, because they want to stay connected. The problem in those situations is sometimes they're connected, but they don't feel close. يعني ما فيش intimacy مع الأهل، ما فيش ability to show up as their full self, because في الآخر they've had to disavow feelings or create a certain facade of defenses. So I will challenge them eventually if there is space for it, but in doing so, I'm also very mindful not to shame the parents. يعني إحنا برضو we need to hold as therapists in parents have limited toolkits as a result of their own upbringing, okay? As a result of their own trauma. The way I would phrase it is, it sounds like they hurt you. It's probably not, I can imagine, I'm sure, whatever. Probably, I can imagine, I'm sure, depends on the patient. It wasn't intentional, but they had a limited toolkit, and that limited toolkit hurt you. Can we hold both, right? Can we hold that they love you and they hurt you? And this is a huge part of trauma work, right? To try to integrate. يعني هو في الآخر trauma, you split off feelings. You're like, لا ده مش هقدر, I can't hold this while I feel this. What my goal is for them to learn how to feel two feelings at the same time. It's like the DBT both ends, right?
I love that, and I think this is very culturally sensitive كمان بالذات انه I think it's ده في كل حتة، بس كمان particularly في الكالتشر بتاعتنا ممكن الناس تبقى defensive قوي على حتى لو انا قلت حاجة ليها علاقة بأهلي. You as a therapist you're not allowed to say that قوي، يعني هبقى defensive قوي لو قلت حاجة زي كده. And it's important to be able to hold both sides. I love that. I'll ask you one last question عشان يبقى في وقت للناس كمان لو عايزة تسأل. If you would tell us today one thing about trauma that you feel it's important for everyone here to know. يعني هنمشي النهارده عارفين متعلمين حاجة عن trauma. What would that take away be?
Trauma, the way you develop after trauma doesn't say anything about you, that you are inherently bad. And it's not your fault. It's not your fault that you've developed to become this way. These are your defenses. You weren't given a holding environment that you needed to develop a secure sense of self in relation to others. But I think that's my takeaway, right? And like another takeaway is, and I really want to emphasize that, like personality disorders are not برضو something to be like, oh my God, so disgusting, okay? يعني it's something we need to approach with empathy, And we also need to bear in mind when we're working with patients who might have personality structures as a result of what they've experienced, be it narcissistic personality disorder, BPD, avoidant personality disorder, OCPD, whatever, and if this was their way of defending themselves, especially with BPD, what I try to remind myself is that the trauma doesn't need to be humongous, okay? Well, some kids are born more sensitive than others. And so if you're a more sensitive kid, it's like the way that DBT talks about it, the biopsychosocial model, is you're walking around with an open wound. Anything that touches it hurts it a lot, okay? But if I'm very sensitive and I grow up in an invalidating environment, it's really hard and it can feel very, very traumatic, okay? But to be able to put yourself in the patient's shoes and to understand that there is a reaction while also holding them accountable to change, because they need to want to change. And one last thing is to remind patients that ما فيش حاجة اسمها I am fully healed, okay? كلنا, if we're put in certain environments, we regress, okay? And so what I hope for patients to learn is, okay, I might regress, can I accept that? But can I eventually have a bit of more of a choice about how I regress, how long I regress for, right? So it doesn't feel like they're on autopilot all the time.
I love that. It gives a lot of hope لأن ناس كتير بتبقى حاسة فعلا if they've done يعني شوط كويس في الهيلينج بتاعهم بيحسوا اللي هو ايه ده how come I still come back لده تاني. That's a great reminder. Thank you. Question?
And I have a question. Thank you for the book. It was very nice. But something that I've witnessed is like finding people who went through very severe trauma, but they didn't develop any defenses or cognitive distortions, and they have a lot of like awareness and healthy cognition, but the symptoms are very physical and somatic. So like, how would the intervention approach differ? But also like, to what extent is it important or even useful to go back to the trauma to point to the cognition and to the meaning of it? It's really something that is not affecting your cognition, but it's physically your body, even though they're related, of course. But how does the physical symptoms come along with it? Like cognition is very helpful.
And I love that question. It's such a good question. I think we need to meet our clients or patients where they're at, right? So if there's a lot of somatic symptoms, what I often recommend for patients, if I feel like there's like, لا أنا مش عايزة أعمل الشغل ده دلوقتي, or maybe I don't like, it doesn't feel like right for me, is to do more somatic work. There's breath work. It's like, I don't know, like for me, what I've found for some patients helpful is like abdominal massages to like remove some of the knots. Qigong can be really helpful, right? So to meet them where they're at. But I think it's important for us to know that, for instance, women usually get more autoimmune disorders than men, right? So it just tells us a bit about حتى لو أنا مش مستوعبة قد إيه affected me, this is probably the defense, right? Like, I don't want to lower my walls right now because if I realize how much it hurts me, I'm worried I'm going to disintegrate. But I would start with the body, and I think even if you're doing therapy, the body is important. And if like the body keeps the score, right? Like, I hope that answered your question.
So I love the conversation you guys were having about kind of the integration of culture into all of this. Something I think we've had several conversations about that I find very, very interesting and that I'm very curious as to what you guys think about is if someone comes into therapy and they're saying oh, this used to happen to me as a child, but this is normal, أو كانوا بيعملوا كده عشان اثنين ثلاثة. That's something. But something else that comes to mind is the general public. This is the meaning they have made out of the situation. It's so interesting to read Facebook posts of people still saying my parents did that and they did that because they cared about me, or because the meaning they make or they associate with that behavior, though the behavior itself is very harmful, is actually very positive. But I find myself always thinking about the struggle between physiological, a child getting hurt in childhood is it induces fear. But the other side of it is if you make meaning out of that and when the parent is present or they're trying to take care of me or whatever, is that still fear? or is that a different way of making sense of that situation? Because we can do very physiologically difficult things and make sense of them in a positive way, and then they're not traumatic per se. So from a culturally sensitive framework, do we interpret that as fear and with that defense of someone trying to make sense of it whatever فبنقول إنه هو ده العادي، ولا maybe culturally we experience that differently that would be perceived in a lot of when we're around.
I think so. أظن فهمت، لو ما فهمتش وجهيني، okay? I think it's still fear in childhood. يعني هو في الآخر it's still fear and pain in childhood. But I don't think, and I think that's important, I don't think everything يعني has to traumatize. فاهمين قصدي؟ Like I think we say ده X حصل في حياة البني آدم فبالتالي they need to be traumatized. أو العكس يعني ممكن حاجة صغيرة قوي فتقولي لا صغيرة قوي هو مش traumatized. So I think it really depends on the person, how they make meaning of it. Again, like also remembering some people are more sensitive than others. بس أنا لما أنت بتتكلمي all I could think of is like who's this person protecting? Are they protecting themselves? Are they protecting their family? Are they protecting the culture? Yani, there is a reason why they make meaning of it, and honestly, it's a good defense. Yani, it's protecting them from pain.
Yeah, very interesting question. صراحة بفكر كمان إنه at the end of the day, بالذات when we look at it from an attachment lens, the child wants to have a relationship with the caregiver. فساعات اللي هيخليني I have a relationship with that caregiver, this is meant to be something that I use, whether that's a defense ولا أي حاجة. فلو إن أنا I rationalize أو I interpret الحاجات بطريقة معينة, this will make it easier for me to relate to you. Well, that's working in some cases. It's interesting to to see it from that perspective.
Sorry.
لا.
لا. أنا كنت هزود حاجة عشان دكتور نور فكرتني بحاجة and I think then you have to question though what will happen to their kids, right? Like I think it's like this whole cycle. And so yeah, I think this is where I become dumbfounded, right? Like because خلاص they make meaning for it, the kids will make meaning of it, مش عارفة إيه. بس في الآخر إحنا هنبقى society يمكن مش very in touch with our whole self, with all of our feelings. But I think now that I'm speaking out loud, like that's part of being in a collective society, right? Like shame in general is a feeling that collective societies have more of because this is how you stay intertwined.
Can I just respond to
Yeah.
that quick thought that came to mind? I think I completely agree with that, and it's super interesting to think about just because if we're talking about it maybe in another culture, I can also imagine and there's two layers. There's the physiological aspect of the fear, but there's also everything else that comes with the fear of and I'm rejected by the parent. If يعني لو هما بيضربوني لو هما بيعملوا كذا كذا كذا, they are rejecting me or I'm not like people around me. I think ممكن in certain collectivistic societies, ممكن in Egypt, ممكن في الأماكن دي that's not necessarily how it's interpreted. So there's the initial layer of this was painful, but the second layer of this was rejecting or this was ده مش موجود. I find myself just always thinking about that because it will probably continue, but في نفس الوقت changing one person in a whole society that still tells them the same messages is still kind of like on a community level. It's like, okay, where are we going from here?
But I think it's about like holding space for the text and the subtext that goes in. So sometimes within the subtext, I need to keep space for, are they saying it because they believe it and that has one meaning? Or are they saying it because society is telling them that this is what it is? And if I hold the space for that and then I can leave space for the client to explore, then they can reach the resolution of, are they at peace with this? Or is there something hidden shame? Because shame is the key word in all of this. And so it's about making sure that just because we're trying to what's the English? Just because we're trying to respect the culture. I need to also respect the person
Yeah.
and make sure that their shame has space for it. I think that's always the
A comment that jumps to mind that I often hear in my mind, although this is not related to my specific therapy, because we're also hooked on the pain that we're used to. So if my father used to hit me and it used to make me feel okay, it didn't make me, it didn't hit me, and it made me feel safe. If I will have a partner who hits me, because that makes me feel more safe. I'm just simplifying. And the other thing that I wanted to say, also a quick comment I wanted to make is, we have, Anna personally, in my mind, I have an ulterior motive to move all anxious attachment and avoidant attachment to a secure attachment base. Now, I'm slightly worried about if this is just a thing that I do and I have to take them to a secure attachment. Is this a good thing to do? Or is this, I don't know, and I'm quite confused at times.
Good question. What do you think?
I think, Yani, I would do the same. Like, but, you know, like,
Doctor, he is stumble. I'm trying to put on the stumble.
like,
Yes.
because we will lead, inshallah, more fulfilling lives, okay? But في نفس الوقت, I think part of being in therapy is also eventually, hopefully, accepting that in certain situations, my old attachment style is going to come back up because this was triggered, and to have some compassion for it. I think there's something that we always assume, like, the person is gonna love their inner child and feel so much compassion for them, okay? I think when you've experienced severe trauma, you sometimes really hate your inner child, right? And so it's being able to hold that and work towards compassion for your younger child.
I agree معاك، بس أقول حاجة إنه trying to move clients to a more secure base, that's definitely something that therapists want, بس I would be cautious من حاجتين. أول حاجة إنه أحط label إنه دلوقتي ده غلط أو this is wrong and I want you to change that into حاجة تانية، فالمايند سيت ده هيرفلكت بطريقة معينة على therapy مش بأحسن طريقة in my opinion. والحاجة التانية that I would also be cautious about إنه نبقى عندنا اسطمبة معينة شايفين إنه this is what secure attachment should look like. فكلنا بنحاول نبقى كذا while إن إحنا we can be secure in very different ways. فده بس هيبقى what I have in mind. بس in principle, yes, we want to move into a more secure.
Yes, I agree with you, and I بخاف من السtumble, that's all.
Yeah.
That's why.
Yeah, I have a question. Thank you for the lovely conversation. Because some of this came up earlier. How can you balance between clients who have like zero or like very low awareness versus the clients who have maybe heightened awareness and to a point where it's like almost like considered false psychology. So because of like Instagram and TikTok and they see all these different things, so then they come to therapy and they're like throwing all of these.
They're intellectualizing.
Right, and it's almost like they're labeling themselves as like, oh, I experienced trauma. Like, how do you balance without, invalidating that? Like, you get what I'm saying?
I think the two extremes هيبقوا صعبين in therapy يعني whether the person doesn't have any insight at all أو بالعكس اللي هو I am super aware to the extent اللي هو أنا ممكن أحلل لك كل حاجة وأقول لك الterms وكده لأنه it's a defense في الآخر. Intellectualization is a way that I'm kind of defending myself or I'm putting up the wall أو الحاجات دي كلها. To me, insight is very important in therapy, but the relationship, the therapeutic relationship is my starting point. It's not really about the terms and how we're labeling things, but it's much more about experiencing what that means and why was it helpful? Because that was helpful at some point. How did that help? And is it still helping and so on? I wouldn't just focus on the inside part. حاسة إن حاجة تانية كتير هي هتساعد كمان.
Yeah, 100%. What I'll add to this is also like focus on the feelings then. Right? Like if they're coming at you with logic, our feelings need some work. Because this is something that I see a lot. Like, I thought about it, I processed it. Why am I still feeling this way? You're feeling this way because you haven't felt it.
You're in your head.
Yeah.
كتير مش عارفة نجيب لهم حاجة الأول.
انا رفعت ايدي بس طيب
لا ايه ده مش عارفة.
So it's like a two-parter question. Hopefully I can articulate it well. So we talk about a lot about trauma that you mentioned, which is again بيحصل لي حاجة traumatic. But I'm wondering because I got a lot of clients who you can't really label as they've been through something traumatic, but also they show up with these complex PTSD symptoms. But at the same time, the attachment style بتاعهم مش اللي هو واضح اللي هو this is disorganized or this is كذا or this is كذا. But they sometimes find a hard time trying to identify with in I feel these feelings, but nothing happened to me really. So there's no object to attach these feelings to. What do we do with these people? Because I see these people a lot of as if they're in limbo. We're not able to match حاجة عليهم, but they still experience these things. And when they look at other people who bring things, and they compare a lot of people compare therapy therapy, which is very interesting. But I've had friends tell me when I compared my trauma with my other person's trauma, I didn't feel like mine was a trauma really because they've been through sexual or physical or for me, what I've been telling them is sometimes trauma isn't what happens, it's also what didn't, what you needed that didn't.
Yes.
Is there like a way to conceptualize this or come to understand it?
I love your answer.
Okay.
It's lovely and it's right. It's 100%. I think Kaman, what helps me is the biopsychosocial model of DBT, and I think maybe sometimes even showing it to the client is helpful, right? It's like Ashen, it highlights that some people are just more sensitive than others, right? And so it's برضو على temperament. يعني هو كلنا مش cookie cutters. You just might be a more sensitive person, right? And by continuously asking what's wrong, like what's wrong with me is the shame, right? By continuously shaming yourself for reacting in certain ways, we won't get anywhere. خلاص هو ده الواقع.
I had two questions to compare with each other. I wasn't waiting for questions and sit here so I could pay. So one of them is about locked memories, one of them is about culture. Because I'm curious when it comes to, because my approach, I work a lot with embodiment, so embodiment usually might go to explore locked memories, but with complex PTSD, I think a few clients have these locked memories there. What's the clinical or kind of more structured approach to explore this within the space? The second was about culture. I've mentioned this in a few talks here before. I'm curious about cultural differences you've seen. One thing that always comes to mind for me when it comes to attachment specifically is the difficulty of emancipation in this country. So how difficult it is for a child to take themselves out of that. And so there's in this situation here where it's next to impossible to emancipate yourself and maintain the same lifestyle you had. And so a lot of people have to sit with the person who's causing it. We talked about triggering, disorganized trigger, and how can have the parent triggering that. It's difficult to then work on it. So I'm curious as well if that's a cultural difference you've seen, or does that still exist in the US too?
I'll try to be as succinct as possible. So in terms of the locked memories, I'm very mindful of the research that suggests that the more you ask people about the past or suggest that something may have happened, they might develop memories that confirms that. However, I'm mindful of that when I'm working with patients to not assume. I sometimes have a gut feeling of, okay, maybe there's something more there. This is one of the things that I try very hard not to say out loud. Sometimes we all disclose more things than we want to as therapists. That's something I'm mindful of. Something that I have found helpful with patients whom I feel maybe like the defenses are up, is asking them about their dreams. I know this is a very analytic approach, and some people think it's like شعوذة. فاللي أنا دايما بقوله للبيشنت اللي هو أنا أصلا شخصيا مش عارفة الفاليديتي بتاعت الدريمز، بس يمكن الدريمز يدولنا، يعني في ناس بيقولوا إنه it's just random وفي ناس بيقولوا إنه it gives us insight. بس if we're stuck right now, let's just give it a try. يعني أنا دايما في الثيرابي بحاول أقول let's just play, let's give it a try, tell me what you think, how, and like when they're telling me the dreams, then I go to the feelings. I don't ask about the content of the dream. How did you wake up feeling? How did you feel in the dream? How did you sharfa it? But this is how I try to approach it. In terms of the emancipation, you're absolutely right. It is something I've seen in the cultural difference. ولكن, and I think this is my own biases, and like I'm being very transparent here, and like it's all my own counter-transference that sometimes for patients who have emancipated at a very young age in the States, I wonder like, will they eventually want a relationship with their parents if maybe their parent is dying? Like, will then the grieving process, like the complicated grief, be much harder because they're holding so many mixed feelings? So I think both are terrible.
You mentioned something very interesting about integration of fragments, especially the notion that I feel they hate me, but they could also love me. So how, and I wonder how do we guide clients to hold on to the tension of seemingly two opposite emotions into a coherent narrative that makes sense?
It's a wonderful question. I think it's very hard. Because basically what you're doing when you're trying to do that with a client is you're trying to teach them to mentalize. Mentalization, معناها, like Fonagy talks about mentalization. And what mentalization is to try to understand, hold another person's mind views, try to understand what the other person might be thinking and feeling. لو أنا عندي disorganized attachment أنا ما حصليش كده، ولا caregiver أصلا is so dysregulated إن هو ما فكرش تصرفاته هتأثر فيا إزاي. ف you work towards it knowing that it's going to be a very difficult task. ما فيش اللي هو you have to be patient with yourself and be patient. Like you can throw it. Yes, what I do is I test it. يعني إن هو يعني لو حد جاي لي بريج فظيع لأهله. They have a very limited toolkit. If this doesn't stick and they feel invalidated by me saying they had a limited toolkit, I know it's too soon. أنا زمان بزق اللي هو لا, because you have to see it both ways. If you see it both ways, you're going to be able to heal. Now I'm learning to create more space and wait, be more patient, because over the the person has held those emotions in for so long, they need to come out before we can make sense of it.
It's kind of an addition to what David was saying, the idea that some clients come in with these labels already held, and sometimes they're true. Like sometimes they're really right and they're accurate, and this is actually what's happening, but their understanding of maybe the diagnosis and how it's appearing for them is what needs to be kind of worked on. The question I have is when is it not useful? When is it useful? Like I'm really struggling with diagnosis. Like I'm struggling with, even when the client specifically it fits so well, I'm struggling with it because of the stigma and because of how they see it. But when is it useful to even go towards this? When is it not? Even when the client is asking and wanting this diagnosis or wanting to understand what's happening, and we're explaining everything else but the wording, but it's almost like we're going towards that, and I don't know why I'm struggling with that.
Why are you struggling with it?
I think I'm struggling with it because I understand how the client sees it, and I'm trying first to break up this concept and this idea of a disease, like you see it as a disease almost, being labeled in some sort of way, or even disorganized attachment is hard for me to break up the therapy for some reason, or because of their view.
It's hard to shame them.
Oh, because they're already shaming themselves. So we're still in that phase. Like we're talking about the whole idea of bringing up space to allow these feelings to be expressed and all of that. But when is it time to shift into maybe something else?
I think something like an intervention you can use it. Like I'm noticing a quote from you, like you're really wanting a diagnosis for me. How would that be helpful? What would it mean to get a diagnosis from you? Why do you want it? And to explore that pull instead of resisting any. Okay, your instinct is telling you to resist. This is very valid information. Okay? العبي بقى بالانستنكت. شوفي ممكن تفهمي ايه من البول ده. And then if they say, I really, really want that, what would it mean if, play with it. What would it mean if I die, if the diagnosis were kid? What would it mean if it were kid? What kid? Yani prep before giving.
Also, I wanted to say, adding on to that, like I always explain, like whenever talking to anyone, whether they're pushing to diagnosis or not, is that all of these things are on a spectrum, and like there's no such thing as like this category could be also made for you to get like medical services or to get better healthcare insurance, but like what matters is that like we have the spectrum, and it's only like super important to try to see like how your symptoms fit into a category. If it makes you suffer and it really impairs your life, so this is the main focus of what we try to reduce, but also helping them normalize like how there's like very high functioning people who could be experiencing these symptoms and the same feelings, or even like people who they would think, oh, they don't have anything mentally, they're completely normal, could feel this on a spectrum. So explaining the spectrum to them, and then how in more extreme cases it needs this support. So
I also think like it's what I try to do is psychoeducate my clients about the fact that diagnosis and the DSM in general was created in the West, and so a lot of things show up differently in this culture. And so even though they feel like that label makes sense to them, but it could be that they're just experiencing it in a different way, or maybe even having that label for them is going to be helpful in giving them the peace of mind of like, okay, now I understand why I'm feeling this way. So it's like, I had that same hesitation where it's like X-nay on the DSM because of that, because it was created in the West, but it's important, like what I do is I try to introduce it first and psychoeducate on the history and how the DSM was created. And then if they're really pushing for it, just give them a bit more.
And it might be validating for them.
Yeah.
But I would always ask, always be curious why.
Yeah.
I'm very proud of our students.
It's wonderful.
أنا عندي مليون سؤال.
ممكن نختار واحد؟
أنا حاسة إن we went over.
لو أنت في ناس محتاجة تمشي عشان نخلص.
You mentioned a very interesting point about you learn to wait and just give space, and we struggle with this a lot. I wonder how you deal with the frustration that comes with that. If you are not علشان knowing exactly what would help this person now and knowing what they need and connecting the patterns but just not saying it now أو مثلا saying it and then exploring that it's still not helping them, so it comes with a lot of frustration. Just hearing the listening to that comes with a lot of frustration. I'm imagining I would be very frustrated حتى لو I'm holding the space so I'm waiting I'm being very patient. How do you
why do you think you feel frustrated? What would come up for you? What's the feeling?
I feel like لو أنا وصلت conclusion about this person and I know this person really well and أنا عارفة ممكن يكونوا يسمعوني دلوقتي بس they are not ready to listen to this دلوقتي. And keeping that وإن أنا مطلع وش would be frustrated, especially that كلنا بنحس إن we want to protect this person or we want to just help this person.
صح.
So how would you navigate that?
ما أفتكر أنت قلتيها صح إن أنت الكل بتاعك إنك protect them, to take care of them, to give them care to nourish them. بصي أنا لاحظت إن ساعات أنا بقولها وخلاص عشان بيبقى عندي نفس الكل ده. Some people respond well to it. For other people, it's too fast and the defenses go up. Right? And so if the defenses go up, it's not a bad thing because right, like Winnicott often says, like a good mother is a good enough mother. What he means by it is a mother who makes mistakes, but is able to, who disappoints but is able to repair. فأنت في الحالة دي بالنسبة لي when I say something too fast, لو حصل rupture, it's a great opportunity to repair. That's I think that exactly what you're talking about, this frustration, to become mindful of this frustration, to try to understand, okay, so it's because I want to protect them, for me, it often comes up going through the frustration where I want to be like, I'm going to prove I'm a good therapist. And I think we need to always remember that. يعني علشان it's part like we've trained, we want to say أنا عملت كذا. كلنا بنحب الإنجاز بس to like be mindful of that. Yeah.
I want to take you back to the answer you gave earlier when you talked about how sometimes resistance kind of says when you touched on something too soon. But if I link that back to, let's say, the anger towards the inner child that you talked about earlier, I'm trying to think of how can we validate that anger while at the same time trying to push for compassion for the inner child. And would that anger then almost act like a message that, okay, it's too soon for me to be trying to push for compassion, for me to be trying to go beyond being.
It's a great question. I don't think that anger necessarily is telling us it's too soon. It's just giving us information that there's a lot of shame and there's a lot of feelings of like, why did I let this happen to me, or why did I respond in this way? And there's like anger towards the inner child, but also anger towards probably the family system, and so the anger is just information. I think what I try to do, especially if I'm doing trauma work, is like I actually ask it explicitly, like, does it feel like a good time to start exploring that anger? Like, or I say, look, this is trauma work. I'm gonna push. Okay, but if I'm pushing too hard, you need to tell me to stop. If I'm not pushing enough, you need to tell me to push. Like, this is going to be collaborative work with each other because I want you to feel like you have some control over what's happening.
Can I go back to also a point you guys were mentioning earlier about for some people safety is so foreign, and for some people in therapy there are some people where the more you try to validate, the more I'm noticing that the client is shutting down, or it's so foreign to them, the idea of validation, that they're not able to deal with that. So the only way really they're collaborating in therapy is if I too as a therapist I'm not giving them validation, I'm just giving them like straight face, no reactions, no nothing. And I always find myself in that loop of like, is this in some way re-traumatizing because I'm repeating the same environment that they grew up in where they're not getting that validation, they're not whatever. So it's comforting on the one hand, but it's also counterproductive on the other. So I'm wondering, again, I think it's going back to like holding growth, but like how do you then do that in application?
It's a great question. I struggle with it too, but I try to remind myself that like creating that space where they can share is actually quite different than the space they have. Right? Like, it is a space where they can bring their full self and talk and share. You're not re-traumatizing because you're providing something new. Also, the fact that they're able to come and sit in that new space must be very powerful. I think you can show it with your body language. I think you can. I think they can feel it. I hope they can feel it. What I sometimes say if like I want to validate as مش قادرة because I feel like it's gonna shut them down. If they feel sad and I want to be like, oh, you look sad, like, oh, I feel really sad for you. I don't want to say that. I say like, I feel like there's sadness in the room, but I can't tell is it mine or yours. I have a feeling it's yours. فاهمة؟ يعني كده to like be very gentle when you're making those comments.
I think sometimes it's the very little things that the therapist would say or do, and even body language that would really stick with the client. وبعد كده they would say things like الحاجة دي اللي انت قلتيها أو لما حصل كذا أو the fact that you just accepted me in general، حاجات بالنسبة لنا بنبقى شايفين إنه ده العادي، ده الطبيعي، that you're supposed to do in therapy. حاجات صغيرة قوي ممكن تبقى هي بتعمل أكبر فرق for the clients. I agree with Laila كمان إنه you're not, this is not similar to what they're used to actually in many ways حتى في حاجات صغيرة.
Yeah, حاجة. Also don't underestimate the client themselves يعني. They're يعني عشان بحس إن a lot of therapists they think اللي هو this is a traumatized person اللي هو bird with broken wing. Right? Sometimes they're stronger than what happened to them. Sometimes they can handle the push. دي حاجة. تاني حاجة believe in your presence. You don't have to say anything. Sometimes your presence is more than enough. And I had a client who used to come for 3 sessions. تيجي تعيط بس. And she would leave. Now I feel like I'm not doing anything. I'm not saying anything even. I'm not validating ولا كل الكتاب اللي أنا قريته من الجامعة. And then by the 4th session she was like, you're the only person who's left me do my thing. And that's what I need. You know? So sometimes just your presence is more than enough.
But like this makes me think, because I always think about like the underlying mediator or mechanism of why this intervention is effective. And like obviously this is very important. This to me goes back to like what does healing mean, because it's so different for each person. And this is why I was saying, because there's some people فعلا عندهم وعي كويس قوي and they have like they could develop secure attachment even if they weren't before, and they can have very healthy cognition and very healthy awareness of what is supposed to be like no distortion. Like of course it's a spectrum, it's generally healthy, but at the same time they could still feel numb more like. But then to what extent is that normal to feel these emotions if you've gone through this traumatizing experience? Like when do you know that you've healed, even though it's so case-to-case specific, but there's just so many factors that go into it.
When do you know that you feel? To heal. يعني هسألك بقى in response like who is asking the question? Are you asking that question or is the client asking the question?
Both.
Okay. Why do you think like I would play with that question? عشان this is what's causing that feeling of like هو احنا خلصنا ولا لا؟ هو انت تمام ولا لسه حاسة صح؟ So like playing around with that's the question you want to answer. Why is it important for the client to know that they healed? What does healing mean to them? When يعني تخيل like let her or him play بقى اللي هو what would it look like if I'm healed? What would that look like if I'm not healed? What's happening in my life now that's making me feel like I'm not healed? كده يعني.
I think also something, oh sorry, let's say like I think sometimes also if you've gone through something so unpleasant, it's normal to feel like empty at times or really strong emotions.
It is right, it's a defense, and so like psychoed, that's برضه maybe this feeling is bothering them, right? So what about this feeling is bothering them? Can we access it? عارفة sometimes كمان حاجة أنا اتعلمتها بالوقت and sometimes maybe it's like maybe the person needs something different. Like you're feeling stuck here, and I'm feeling stuck too. Like if it's someone who's a very sensitive, maybe I wouldn't say that. But how about we try something new? Would you like to try something new? Like go somewhere else, someone else. تعملي حاجة somatic embodiment أكتر. To give up, the whole goal is to give our clients the feeling that they have, that they're curious, right? They're curious, they can try, they can explore.
I wanted to ask Laila more when you said the part and sometimes it takes 5 years for the client. مش شرط يكون البني آدم عنده diagnosis fully بس ممكن يكون في part in them that didn't أصلا got addressed خالص. ممكن يكون مثلا في emotional immaturity بس مش شرط ده هو الثاني يعني. ايه اللي بيساعد الشخص ده انه يبدأ او انه يبدأ ده my first بالذات on emotional يعني if there was an emotional lack
Okay.
follow up ليها what would that look like? What would for that person an emotional maturity journey look like?
أنا هريفريز السؤال عشان أتأكد إن أنا فهمته صح. Okay, I'll paraphrase it. If I'm missing something, tell me. Okay, is the question if someone has been feeling a lot of feelings بس مش جاهز يروح therapy ازاي يبدأ connect with their feelings? Is that the question?
and it's hard يعني mentioned حتة إنه في حتى لو قعدت معاه it still takes time ومش لازم في كل الأرياز يعني ممكن في area معينة لا هي فعلا صعبة. فوات helps.
I think patience and grace and self-compassion as a therapist for the client and as a client for themselves. I think the second part is much harder because it wasn't properly modeled to the client. Maybe there are a lot of feelings of like, what's wrong with me? I really wish I felt that. I think again, like it's going back to respecting the defenses, taking it khatwa very slowly, and like constantly being like, gosh, it's like بجد, like I tell some bitch to just say like, gosh, it's been really hard, and having that kind of compassion.
I wanted to ask about sometimes with clients, especially those that do have complex trauma, I've noticed this almost like they're trying to pull out being shamed from me. That makes sense. So it's this constant repetition of how they are bad, to be shamed, and even if like it becomes almost like a covert argument in a way, where it's you're trying to show the angle of compassion and everything else, but it's like they're kind of very much insistent on, okay, but look how bad I was and how much it's I deserve that or whatever. So in that case, how do you tend to go about that? Like how do you work with that?
I think it depends on the patient. I think sometimes I would just be like, oh, it's so interesting this is happening here. Like whenever I try to like say you're good, you say you're bad. Interesting. What do you think that's about? And I'll try to get myself out of the struggle. Because the struggle is a reenactment. I think.
You can say because it seems very important to you that you appear bad to me. Tell me more about that. Thank you. I can sense on you to my we're doing this. What situation are we in?
Right.
Who are you arguing with? Is it me or someone else? You can unpack something.
Any other questions?
Oh, confused.
So you're into very excited and thank you for the questions. Thank you for coming today and to all the other talks. بجد الأسئلة دايما بتبقى خطيرة. والله I really listen and enjoy just the questions and the conversations. يعني more than I can explain. حقيقي. Thank you so much for your knowledge. And
thank you all. Like it was such a joy to be here, and I've missed being here, and I've missed a lot of you. So
thank you. See you back inshallah spring semester.